Hey, what's up, everybody? Coach E here from Precision Movement, and I'm super pumped to announce that we have a new live show, which is Ask Dr. B with Dr. Aaron Boynton here, orthopedic surgeon with a wealth of experience, amazing knowledge base and experience base to help you guys in your goals to move freely and without pain. So welcome, Dr. B, and thank you so much for doing this live show with us.
Well, thank you so much, Eric, for having me. And really, I want to thank you and the team, Yusuf, Madeline, and Josh, for helping me to put this all together. Because really, it's making one of my dreams come true, which is really to help people be able to move pain-free. So I'm very excited to be here.
Cool. So we're going to dive right into it. And the way that we've structured these live shows to go is you're going to present a topic, some information for people. Today's topic is wear and tear, overuse injuries, and how to know if you're going to need surgery or not. And I'm just checking this. We got a little bit of a delay here on my internet. And the other thing that we're going to do is answer anybody's questions. So people who have questions about maybe wanting a second opinion or wanting to get an idea of where they're at with an injury. Now, okay, I'm just double checking here and I have a little bit of a lag. So I'm going to shut this down. I'm going to pause that. Let's see. Just doing a video check here, Dr. B. Am I coming in okay on your end?
Yeah. So, you were a little delayed for a moment there, but you look clear now.
Okay. So what I'm going to do, actually, it might be my internet, but I'm going to turn it over to you to start the presentation. And I'm going to ask people who have any questions to just post them in the chat there on the side. And then I'm going to collate them, and then when Dr. B is done her presentation on wear and tear, I'll be there to feed the questions to her so she can rapid fire smack them back to you. So Dr. B, please take it away.
Okay, excellent. I'm just going to start the screen share here so that you guys can see my slides. So for those of you who don't know me, I'm an orthopedic surgeon. I did my training in Toronto and at UCLA, and I studied sports medicine and shoulder injuries. And most of the injuries that I dealt with were overuse or wear and tear injuries. And I learned very quickly over time that if we did not fix the root of the cause for the wear and tear injury, then my surgical result wasn't going to be as good. So I started to look at how people were wearing out their bodies and what was causing the problem in the first place. And because I had such a long waiting list for surgery, about 2 years, it gave me the opportunity to teach people to change how they were loading the injured part of their body, so say a damaged rotator cuff tendon, and through exercise. And I was shocked that about 70% of the people came back to me and reported that their pain had gone away. And at times I would actually even see that the tissues had healed. And this really surprised me. And for the 30% of people that still needed to have an operation, they tended to get better faster. And I think that this is because they had corrected the root of the problem so that the tissue and my surgical repair were not continually being overloaded, and they could heal faster and function better. And I really got to a point where I needed someone, an expert like Eric, who understood movement and to teach people to change how they move, to help treat people and recover from their wear and tear injuries. So that is why Eric and I are working together, because we both love to help people to keep active and doing the things that they love to do. Now, wear and tear or overuse injuries are very common, and they affect most people at some point in their life. Some very common wear and tear injuries that you may have heard of include rotator cuff tears, meniscus tears, spinal disc herniations, and degenerative arthritis. And today we're going to discuss how repetitive movement will lead to an overuse injury. We'll discuss the goals of treatment and particularly what the role of surgery may be in your recovery from a wear and tear injury. Eric, I don't know why, but I'm not controlling the screen here to...
Well, you're probably on Zoom, so move over to your presentation window, which is probably PowerPoint.
Got it. Okay, thank you. So our muscle, bones, and joints are structured much like this rope. You can see that there's small fibers of threads in this rope that are bundled together to form a subunit. Then these subunits join together to form a larger unit and the actual structure of the rope itself. And you can imagine that this rope is like a tendon and that there are threads of collagen that are fibers in the tendon itself, which may become mechanically overloaded due to repetitive use. Sometimes these little fibers will break, and then more fibers will break until eventually one of the subunits is lost, and so on, until the rope or the tendon itself will actually break. Now, in our bodies, micro injuries occur every day. When we go out and we lift our arm, we might tear one of the collagen molecules. But the beauty of our body and the difference between us and a rope is that we're alive. And we have a capability of repairing that micro injury. And so long as we are able to maintain a balance in the injury and the repair, we don't actually end up with any tissue damage itself. So unfortunately, there are times when we suffer more injury than we're capable of repairing. You have a really long tennis match, you run a marathon, and then you don't give your body a chance to recover. So these micro tears can accumulate, and eventually, over a very long period of time, months, years, even decades, the damage will accumulate. Now, our body has an amazing ability to compensate and adapt to these changes because they're happening very slowly. So often we don't realize that there's any damage to the tissue at all. And we're fine and coping until one day there's an event. And you can imagine that you have this frayed tendon, and then suddenly you have an abnormal force applied to this tendon. You mishit a tennis ball, your dog pulls on your leash, and there's a sudden severe force, and this leads to the tissue completely tearing. And this is often when you begin to feel pain. Even though the injury's been silently building up to this point of pain for years, you're not aware of it until the event. So I'd like to introduce the concept of the performance pyramid. It's an important concept because it provides an understanding of efficient movement that does not overload the musculoskeletal system. The performance pyramid is an ideal, something we strive for, as it will allow us to move without excessive force on our body and enhance our performance. The pyramid represents what is necessary for our body in order to complete a movement task. So there's a hierarchy or prerequisites that we have to achieve in order to move at the highest level. First, the pyramid has a foundation of movement, which means that you have to have good alignment and posture. You have to have balanced, supple, and soft tissues, and you have to be using the correct muscles and use them with good control. Once you have the ABCs, that's the alignment, balanced tissues, and control, then you can build endurance, strength, power, and speed. But you have to go in the correct order. In other words, you have to crawl before you walk, before you run. So when we have a stable and solid performance pyramid, our movement is efficient and balanced. Movement's easy, and there's very little excessive mechanical load that's applied to our tissues. So there's very little tissue breakdown, and the body is able to maintain that balance of injury and repair. And this is our goal. The two main reasons that I see people in trouble with wear and tear pain have to do with, firstly, they've lost their foundation for movement. And this is so easy to happen. Just sitting at our desks and working on a computer or driving for prolonged periods of time, we often lose our normal alignment and adopt abnormal postures. So right then and there, we're losing our foundation for movement. And then the second issue is that people will climb up the performance pyramid too quickly. So they'll try to do an activity that requires power and speed before they really have the strength to even lift their arm up over their head. So when you don't have a good performance pyramid, this leads to inefficient or imbalanced movement. And this eccentrically loads tissues, which accelerates the wear and tear and leads to more aggressive fraying and tearing of the tissue. And then at this point, our body isn't able to keep up with the injury that is occurring on a daily basis. What I'd like to do is introduce you to my friend, Abbi. Abbi is a dear friend. We've known each other for a really long time. And she is a very passionate tennis player. Right now, she's 62 years of age, and she's played tennis all of her life. She played as a junior through college. She's coached and taught, and she continues to be a very active member of the senior tennis leagues, and is a very accomplished player, winning a number of national championships. And she got pain in her shoulder about 8 years ago. One day she was playing a match, and she went to hit a serve, and she got a sudden, severe, sharp pain in her shoulder. And although she was able to continue playing that match, she couldn't hit her first serve anymore. And the next day, she got up, and her shoulder felt a bit stiff and sore, and it was bothering her even when she was just lifting her arm up to brush her teeth. She took a little Advil, put some ice on her shoulder, and she was able to keep playing some tennis. But eventually the pain progressed to the point that she was having trouble just doing her usual activities of daily living. And at that point, she went to see a doctor. The doctor examined her and ordered an MRI of her shoulder. And the MRI showed that she had a near full thickness tear of her rotator cuff tendon, just like that frayed rope that we saw at the beginning of the presentation. So the tendon was still attached, but about 50% of the tendon was frayed. So how did that happen? Well, by playing a sport like tennis, which involves repetitive movements, Abbi developed imbalances in her body, and she lost her foundation for movement. So what happens is when you repetitively serve, or you're throwing or hitting an object, your body has to slow your arm down and prevent your arm from flying across the net with the tennis ball. And after hours, say, of hitting balls or a particularly long match, the muscles at the back of your shoulder can get fatigued and tire out. And then the only tissue that's actually stopping your arm from flying across the net would be the soft tissues, the ligaments and the capsule. And what happens to our tissues when they face increased stress and repetitive movement is that they get thicker or strong and try to make themselves stronger so that they don't get damaged. But the problem is with this thickening of just one portion of the joint is it leads to a change in alignment of Abbi's shoulder. And so after years and years of doing this, she had a malalignment of her shoulder and had to adapt in her muscle function. And these adaptations and changes in alignment led to increased wear and tear on the rotator cuff tendon. Now, this whole process of deterioration in Abbi's shoulder actually occurred without her even knowing. By serving and doing the same repetitive motion, she lost her foundation for movement, But unbeknownst to her, she was actually trying to compensate, because your brain is always telling you, okay, I have this goal, I've got to hit this ball, or I've got to do this action. And so you compensate. And so the injury progressed over the years and actually snuck up on Abbi, until eventually she had that event, the slight mishit of her serve. And it was the straw that broke the camel's back, and she developed pain. Now, once you get the pain, there can often be associated inflammation, and this can exacerbate the problem, because the pain will shut down some of the muscles, and other muscles will actually go into spasm and try to prevent movement and prevent any extra stress on the injured tissue. So this is an example here. This isn't Abbi's shoulder, but this is what Abbi's shoulder looked like. And you can see that her left shoulder is lower when you compare it to her spine. It's lower on the left compared to the right, which is in a normal position. And you can see that because of the repetitive movements and balance, that her shoulder blade is actually farther away from the spine. So if this is the spine, and you look at the distance between the spine and the right shoulder, and we compare it to the left, you can see there's quite a significant increased distance. And so this changes the length of the muscles, puts extra stress on some of the tendons, and these muscles won't work as effectively. And because they're not working effectively, other muscles have taken over and compensated. So what do we do to deal with this issue? What are Abbi's treatment options? So let's think about the traditional things that people will do. They may rest. So this is a good thing, because you stop the wear and tear. So you're stopping the tearing and you're stop damaging the tissue. And the rest will allow your body to actually decrease the inflammation and the pain. So you start to feel better. This is something I really commonly hear. People go to their family doctor. The doctor says, well, it hurts when you play tennis, so don't play tennis. You don't play tennis, you feel good. And you think, okay, I'm ready to go. 6 weeks later, you get out, you get on the court, and you start hitting balls. But because you haven't addressed the imbalance, because you still have the poor alignment, because you still have compensatory movement patterns, the pain just rears its ugly head really quickly. What else can you do? You can go to see a physical therapist. You can get some laser, some ultrasound, and this can be really effective in improving the blood flow to the area, so that you bring in healing factors and you decrease inflammation. So this may actually promote some of the tendon healing. But if you've got the tendon healed, but you don't rebalance it and take the pressure off it, the tendon will just break down again. Giving an injection, something like cortisone, can also be very beneficial, because it will decrease inflammation. But again, same problem. You're not addressing the malalignment and the muscle firing patterns. Doing some static stretching, there is a role and a time and a place, but it's not really effective in this situation, because what happens is that the tissues at the back of the shoulder, right in here between where the ball and saucer of the shoulder move on the shoulder blade, they are stiffer and thicker. So when this young lady is stretching her arm across her body, you can see that she's actually moving between her shoulder blade and her chest wall. So she's actually stretching the muscles that are already too long. So that's not very effective. And then surgery, my favorite, of course, because I'm a surgeon. Go in and fix the tendon. Well, that's all well and good, but you can fix the tendon, you can put the tendon back to the bone. But if you don't rebalance the shoulder, if you don't fix the alignment, and if you don't fix why the muscles have shut off and don't correct that, the surgical repair is going to become overloaded, and the tendon's going to re-tear again very quickly. So things that can be really effective, massage, ART, active release therapy, or acupuncture, can help to loosen the tissue so that you can restore the normal alignment to your body. The problem and the story that I often hear in this case is that if people feel fantastic after they have the initial treatment, but as soon as they go back to their activity, the pain recurs. And that's because they haven't changed how they move. So they go back and they keep repeating the same thing over and over again. And it's great for the therapist pocketbook, but not so good for you. One of my favorite, and something that Eric and I both promote very, very heavily, is active self-myofascial release. And this is Eric, and he is demonstrating how to do an active sleeper stretch. And we have a link for this on the presentation YouTube website. So what you do in this situation is you pin the tissue with a ball or a foam roller at the back of the shoulder, where the shoulder is tissue is thick and stiff, and then you actively move the arm. And this does a couple of things. It sets into play a neurologic mechanism that will cause the tissues to relax, and it also starts to activate the right muscles. So this is a very powerful technique that both Eric and I promote. So I can't emphasize enough the importance of restoring the balance to the soft tissue to allow you to then turn on the right muscle. But it's really important that you activate the correct muscle. And I think this is what most people miss in their usual traditional treatment. And I look at these muscles much like a cell phone. The cell phone can go into sleep mode. The muscles in our body can go into sleep mode. So what we have to do in order to restore proper movement patterns is to waken them up or activate them. And Eric has got some amazing techniques that he has developed that really promote the development of proper movement patterns. He refers to it as dissociation. And this is a talk in and of itself. So happy to do that one in the future. So Abbi did a really good job of establishing a foundation for movement. She was able to do some active self-myofascial release to restore the balance to the soft tissues around her shoulder. She got the right muscles working, and she started to build some endurance, and she started to feel a lot better. She was able to return to her usual activities of daily living, and for the most part, pain-free, and could sleep at night. So she was a lot better and much happier. The problem began when she wanted to go back to playing tennis. And when she started to go back to playing tennis, her pain recurred. And so there are two possibilities for why her pain continued. It was either she was going up the performance pyramid too quickly. So she would go out and she would try to hit her serve too hard. That is something that required power and speed within her arm itself. And so she maybe didn't have enough endurance and strength to do that. If you go too quickly, you don't allow the tissues to adapt and to recover properly. Or the other problem can be that the structural injury, that is the tear in the tendon, is too great, so that when you get into the higher strength and power and speed parts of the performance pyramid, the body can't tolerate the load. And this is where Abbi and her surgeon need to talk, and they need to figure out what it is that can be accomplished by surgery. What is the goal of the surgery? Abbi could say, well, you know what, I don't want to play tennis anymore, which I can't imagine her saying. I can't imagine I would say that. But she could make that choice. She could say, you know what, I don't want to play tennis anymore. I don't want to go through an operation. And she could be very happy doing activities that didn't overload her shoulder. So if she was somebody who enjoyed gardening or activities that weren't repetitive and overhead, she may avoid an operation. But the fact is that Abbi wants to play tennis, and there is a structural injury. So what can be done from a surgical standpoint is you can repair the tendon back to the bone, and you can take some of the pressure off it by removing bone spurs. And so then this will allow Abbi to progress through the performance pyramid once the repair has healed. And Abbi did have the surgery, and she actually had the surgery in November, and she did amazing. She was really a star pupil. Because she had already done a lot of the work before her operation, she regained her foundation for movement very quickly. And then once the repair healed, she was able to strengthen and progress up the performance very quickly, pyramid very quickly. And she had fixed the root of the problem. So once her tendon healed, she was able to get back out on the court and play. And in June of the following year, she won a national doubles tennis championship. So it really is a great success story. Now, in October last year, so this is about 7 or 8 years after the surgery, Abby started doing a new exercise. She wanted to get her biceps pumped up, and she started getting some pain in her shoulder. And I happened to be with her and had a look, and she had started to redevelop some of the imbalances around her shoulder that had led to her rotator cuff tendon tearing in the first place. And this is what happens because she's still playing tennis. There's that continual stress on the shoulder and on the tissues that will create the imbalance. So it's very important that you do something and that you take charge to rebalance your body before you go out for your activity. And Abby actually took the shoulder control course with Eric, and her symptoms went away very quickly. And she's now serving them up better than ever. I can't wait to get out in the court and play doubles with her again. So sometimes we run into problems with rebalancing the body. And this can be for a number of reasons. One, you don't activate the right muscles and change how you move. You feel really great. I don't know how many people I had who would come and see me and say, oh, like I was doing amazing. I saw you like 5 years ago and everything was great. I did all the exercises. I could do anything I wanted. But in the last, few months, my pain has come back. And then I'd find out that they weren't continuing to do the rebalancing exercises. And so the whole problem started all over again. And probably one of the most difficult to deal with is poor tissue elasticity. With repetitive injury and repair, the tissue itself can get stiff. And that makes it difficult to restore that usual balance. And so I hope you'll join us next week to get some tips on how to effectively establish and maintain the balance of your soft tissues. And finally, I just want to leave you with the important message for today, which is don't stop moving, but change how you move. Change how you move so that you can restore the foundation for your performance pyramid and then get back to the activities that you love to do. So that's all I have to say about wear and tear injuries for now, and would love to entertain any of your questions.
Okay, awesome. Thanks for that, Dr. B. Actually, you know what? Because I'm the host, I'm going to ask the first question. I'm going to take this opportunity. The rest of you can wait while I ask my question. So massage, you mentioned something about massage, ART, acupuncture, and they're good therapies to do initially to relax tissues. Mm-hmm. How long, what's the kind of time course of that? How many sessions of massage do you think are sufficient, or before, or how many sessions do you need and then you have to do other stuff? Do you have any suggestions on that? Same with ART and acupuncture. Is it like 1 or 2 massage sessions and then you got to start the movement stuff, or is it like longer than that, 6 sessions, 2 months, 3 months? What do you think?
I think it depends a little bit on how much inflammation you have associated with the wear and tear. So if you don't have a lot of inflammation or pain and you go and you have your massage and you really feel good and you're able to move pain-free right away, then I would say you go from the rebalancing to reactivating that day, because the only way that you get the changes in your body to stick is by reactivating the muscles and using the muscles in the correct order.
Gotcha. Okay, perfect. Thank you for that. So it does depend, but it's based on pain and how you're feeling.
Yep.
Cool. Okay, so let's get to some questions here. We got Istvan Sekeli is related to the causes and remedies for Baker's cyst. So maybe you can describe a little bit about what Baker's cyst is, and then what causes it, and anything that you know in terms of that would be helpful.
Okay. I know Susanna Secoli. She's hiding under another name, but hi, Susanna. So a Baker's cyst is actually very similar to maybe a ganglion that you might have seen of your wrist. So it's a little outpouching of the joint capsule. Now, it is more of a symptom rather than a primary problem of a degenerative condition. So very often, if I see a patient who has a Baker's cyst, I examine their knee and I look for either a degenerative meniscus tear or arthritis. And so what you really do is you treat the primary issue, which is the meniscus tear and or the arthritis. So by restoring normal alignment to the knee, by restoring the normal balance of the muscles around the joint and getting the right muscles working, you can take the pressure off the joint so that the Baker's cyst can actually resolve. The cyst itself is kind of like, if you imagine a cauliflower, a head of cauliflower, you've got a little stalk, and then you've got the cauliflower on the top. The cauliflower head would be the Baker's cyst, and the little stalk would be where it attaches to the joint. And when you get the damage in the joint, fluid leaks in through the stalk and up into the head. And so long as you take the damage and the load off the joint, you decrease inflammation, which will then decrease the fluid going into the cyst.
Awesome. Okay. And there's a follow-up comment here from Istvan. My previous injury was a suspected medial meniscus. So with her case specifically, is there anything else that you would recommend?
Well, she might want to take one of our courses to work on changing how she's loading her medial meniscus. When you look at somebody who has a medial meniscus tear, it could be because how their legs are aligned. So if they're a little bit bow-legged, particularly with a medial meniscus, that's the meniscus on the inside of the knee. Often people are a little bow-legged, or what we call invarus. We can't do anything about that short of surgery. But what you can do is make sure that the hip and the ankle are not only moving properly, but the muscles around the hip and the knee are functioning properly. The way I look at the body is that you have alternating segments of mobility and stability. So the foot, you have the toes that are mobile, the midfoot is stable, the ankle is mobile, the knee is stable, the hip is mobile. If you lose mobility in the hip or the ankle, then the knee has to compensate, and the medial meniscus becomes the victim of those compensations and then often tears. So I would advise Susanna to change how she's moving by making sure that her hip and her ankle are mobile and that she's using the correct muscles there. And then the knee just takes care of itself.
Cool. And I'm guessing that you would recommend the meniscus program as a place to start.
Absolutely. Eric and I have developed this meniscus, a meniscus program. And it's for people who are really in the very acute stages of the injury. So the injury has just happened. They've got a lot of pain, swelling, they're having trouble walking. And we take you through a series of exercises and things that you can do to achieve the goals that we've been talking about today. And I think that it's so important that we keep moving. I learned this throughout my surgical career that when people can have the right muscles firing and working, they get less swelling. When they get less swelling, they don't lose the mobility of the joint. When they have less pain and swelling, the muscles are able to react and become stronger much more effectively. So doing some kind of motion, even though you have this injury, is really important for your overall recovery. So we've got I think, a great little program that we've put together that will help people in the acute stages of a meniscal injury in their knee.
Cool. Okay. So I posted a link to that in the chat, but it's you can find it at precisionmovement.coach/meniscus. And you can check that program out there. So the next question, I believe you know the author of, as well. Patty Henderson.
Oh, hey, Patty.
How do you determine what the correct endurance and strength levels are before moving up the performance pyramid?
Oh, that's a great question. So first of all, by the time you're moving up the performance pyramid, you really shouldn't have any pain. So you have to have that foundation for movement. As you go from endurance to strength, as you start challenging your system, you just want to make sure that before you go to the next level that you're maintaining your range of motion, you're maintaining alignment, you're maintaining soft tissue balance, and you're still using the correct muscles. So oftentimes what happens is if people progress too quickly, they start to go backwards a little bit. Their poor posture will recur. They'll start getting more pain. They may get some swelling. And so if that happens when you're trying to progress up the pyramid, then what you need to do is go to a stage before and in your workouts. And I always tell people that what they need to do is build the duration first and then build intensity. So for example, with pitchers, who had a sore elbow, you've probably heard of Tommy John surgeries. What we would do is we would have them go out and they would do just a short toss. So what they're doing is they're working on getting the rhythm of their mechanics back. They're getting the rhythm of their movement back. And that once they can do the short toss, say 100 throws, then we allow them to go to long toss. But then we'll cut the number of throws back to maybe 20, and they'll just do 20 throws of long toss and then progress up to 100 throws. Then they'll go from throwing their usual pitching mechanics, but not on the mound. And again, they'll start out with 20 throws. And so long as they feel good, no pain, they're maintaining their alignment, they're maintaining the balance of their soft tissues, and they're using the correct muscles, they can progress to the next level. If, as they start to climb that performance pyramid, and say they have a bad day where their shoulder starts to bother them a little bit or their elbow starts to bother them a little bit again, then what we do is we back off when we go to the day before where, okay, we're going to actually reestablish the foundation for movement with various exercises. And then you go back to only the 20 throws, not 50 throws, and you progress back up again. So I hope that makes sense.
Yeah, I think it's pretty clear to me, but if you need any clarification on that, Patty, or want more specific info on your situation, then definitely post it in the chat. We'll get back to it. But basically it's slow progression, really pay attention to pain and function, and yeah, take your time, no rush.
Yeah.
Okay, so Carrie Sullivan had suspected tennis elbow and left arm from golf. I'm right-handed, so it was the lead arm. Elbow better after physio, but pain now on upper outside of arm when raising to the side. Thoughts?
Maybe, hi Carrie, maybe it's some form of compensation. And oftentimes when I see people who have hand, wrist, or elbow problems, I look up at the shoulder. Remember the picture of the shoulder blade, which was in the wrong position. What happens, we know that people who have this, it's called scapular dyskinesia, they've got about a 75% chance of having an injury somewhere in the upper extremity, because what happens is you lose your kinetic chain. You lose the transfer of force from your feet and your legs. So when you're golfing, where the power is supposed to come from your legs and your core, when you have an abnormally positioned shoulder blade, you lose the transfer of the kinetic force from your legs to your arm, and that increases the stress down the chain in your elbow, the wrist, and your hand. So I would look at have your physio look at your shoulder and make sure that it's balanced, and do some exercises for your shoulder to actually treat your elbow.
Okay, yeah, that's definitely one of those things that we talk about all the time, is the compensations. And from the sounds of it, it might be some, what do you think, rotator cuff, upper outside of arm?
Very
that
possible.
might be getting involved. It's the golf swing.
Mm-hmm.
So yeah, I'll post some stuff in the chat as well, some links to other resources we have on YouTube for exercises to help to restore the proper scapular motion.
Excellent.
And that might be a great place to start. Okay, next up, there's just a comment. Hi, it's Tanya.
Oh, hi, Tanya. How's your elbow?
Okay, next up we have Suzanne. Oh, I think that might be the extent of the questions. Yep. No, sorry, I missed a couple. I got pushed down. So this one is from Cordy Force. Don't know that name. Maybe explain to me what that means, because I've seen it here a few times. But number one, my knee cracks and snaps, but those aren't painful at all. I also feel what seems to be a shifting sort of motion sometimes when movements like hamstring curls, but no pain. Should I be wary of this? That's part one. So maybe you could address that.
Okay, I don't usually worry about noises, snaps and cracks, unless it's associated with a specific traumatic event, or if it's painful and there's swelling associated with the tissue. So, we can move our neck around. I move my neck around like this and I hear it cracking and popping, and I don't really get too concerned about that. Feeling a shift in your joint, that's a little bit more concerning. We want the joint to stay well lined up. So when you describe a shift like that, it makes me think that, that the circle is becoming off center. And so it's very important that you make sure that the tissues around the joint are balanced enough so that when you activate the one muscle, the joint is able to stay centered. And you also need to make sure that you're activating your muscles effectively, because they impart dynamic stability or maintain the dynamic alignment of the joint itself. So it would be a warning to me that you're pre-injury, that you need to address something and change how you move.
Okay, so maybe with part two, that'll give you some more info to follow up on that one. Okay. Does meniscus pain extend to the upper calf and lower hamstring? I very rarely have pain at the medial joint line, but when going into extreme flexion, such as sitting on heels, I'll feel discomfort.
That's possible. And I'm curious if you do ever see any swelling in your joint. There are a couple of things. You could have a meniscus tear, and you actually could have a little Baker cyst that we talked about earlier that's developing. And at the back of your knee, if you feel around the back of your knee and you compare one side to the other, you may feel a little fullness there. And oftentimes a Baker cyst will cause pain to radiate down into the calf. But just when you're in that maximum degree of flexion, it could either be the meniscus or the joint surface itself that's being overloaded. And Eric did a great live session on Tuesday where he introduced this concept of using your hamstrings to kind of keep the tibia, which is the lower leg bone, in the right place when you flex into maximum knee range of motion. So I would look at those exercises as an opportunity to fix that sensation that you're having.
Cool. And I know Cordy Force was here on Tuesday, and he has one question here related to that live workout. And it's, I advocated, or I was teaching an exercise where you sit back on the heels with that hamstring activation and using a pillow if you can't get down to full flexion or some kind of support. And he's just asking if when performing the sitting back on heels movement, is it okay to slowly push that range, like decrease the amount of support used so the butt can get lower? And yeah, totally. That's the whole idea of that.
Yes.
Start with whatever you need, 6 to 8 inches, and then decrease an inch at a time as you gain that range actively. You're not forcing it and pushing it passively, but you're being able to pull yourself in there and get out of there through your own muscular control. So I'll put a link to that live workout as well, or that workout where we did kind of advanced stuff for knee rehab, knee stability, for anybody who's suffering from kind of meniscus injuries or anterior knee pain or unstable knees. Okay, next up we have Nargil. My shoulder has what I can presume as good mobility and rotation. Whenever I work out, the shoulder will eventually suffer weakness and burning pain. It tends to crackle and pop more than the other. I lower high speed based reps or heavy sets. The pain tends to not come out. or when I lower high speed based reps or heavy sets, the pain tends to not come out. I was wondering if this is just an impingement issue, if it is more rotator, shifting of posture. I sleep on said shoulder.
It's a little hard to say just from that, but it's probably a combination. I find that it's either an issue where you've got to build the strength of the muscles and the correct movement patterns so that you can progress from just being strong to be able to do something with power and speed. So it could just be a training issue. But if it's actually an issue with your foundation of movement and the alignment of your shoulder, you're going to have a difficult time in progressing. And when I hear about the crackling and popping more on that side compared to the other, it makes me think that there may be some overload and inflammation. So I would look at your shoulder blade, see how the muscles in your shoulder blade and even your upper back, your thoracic spine, to make sure that that's moving properly so that you are able to ensure that you can strengthen adequately then to allow yourself to move quickly and with power.
Right. And I posted, just to follow up on that, an exercise a long time, years back, that was training eccentric loading at speed of the rotator cuff.
Mm-hmm.
And it was using one of those little Pilates balls that weighs maybe a pound.
Yep.
And basically having somebody throw it this way over you, and then you catch it like this.
Right.
So they throw it, the ball's coming in this direction, and then you just catch it.
Catch it and slow it down. You slow your arm down.
Yeah, and I was using this I use this specifically for fighters because the same kind of thing. Throwing a punch, you're eccentrically slowing down. You're using eccentric contraction to slow down your arm so it doesn't get thrown out of its socket. So that's something that I'll take a look at and see if I could find and post up in the description for Nargile here. But we don't have any idea on what the exercises that you're doing that are causing this issue. So if you maybe identify the specific exercise, that would be definitely more helpful. I have a question just to follow up on that, the burning pain. What are you thinking there? Is that related to the misalignment, impinging on a nerve, touching on a nerve or something like that?
You know, pain is an interesting beast. And I actually want to do a whole talk on what pain means. Sometimes you can just get burning pain if a muscle is overworked. Definitely if you have burning pain that radiates down the extremity and is associated with numbness and tingling, I'm concerned about nerve impingement. But it's a little hard to say with just a burning sensation whether or not a nerve is involved. It could be, but sometimes your legs will just burn just because you're out of oxygen and glucose, and it doesn't even really mean there's pathology. It's just your body telling you that I don't have any oxygen, I don't have any fuel left, and I need you to rest.
Cool. Okay. Yeah, it definitely helps to distinguish the type of burning. If it's the lactic type of, I've been doing 100 jump squats and my legs are burning type pain versus I did one move and it's kind of a burning / tingly type of pain that can help to identify what's going on better. Lisa Bentley, she's looking for your thoughts.
Lisa.
Another fan. Looking for your thoughts on my posterior tibialis tendon and healing with flat foot.
Oh boy, Eric is going to have some amazing exercises for you. You know, one of the first things that happens to people when they have tibialis posterior tendonitis and a flat foot is they go to the doctor and they end up with orthotics. And what my recommendation is to waken up the small muscles in your foot so that you can actively recreate the arch in your foot. And this will help take some of the pressure off of your tib post tendon, because when your foot, the small muscles in your foot, they're called intrinsic muscles, aren't working properly, then the foot becomes flat, which then puts extra stress on the tib post tendon. So I would really focus on mobility and strengthening the small muscles in your feet, and make sure your ankle motion is good. And Eric has got some amazing exercises that help to activate these muscles.
Cool. And she's saying here, got a follow-up comment, it's a full thickness tear. So does that...
Oh, a full thickness tear of your tib post tendon? Wow. Okay. So have you had surgery to reattach that? I would kind of need to know. Oftentimes, surgery is required to reattach the tibialis posterior tendon to the bone. This is one of those tendons that can be very difficult to get to heal post-surgery, because what happens is that you reattach the tendon to the bone, but if you don't address the flat foot and why that tendon tore in the first place, then the repair has a great deal of difficulty healing. If you don't have surgery to repair the tib post tendon, then you're going to have no surgery. Okay, so then what we're going to have to do is, and I guess I would need to know how long ago. If it was a really long time ago, then it may not be possible to fix it. What I would focus on is trying to get other muscles to compensate for that lack of a tendon in your foot. So that'll mean activating all the little muscles in your foot and activating more muscles in your calf to try and compensate. And it's possible that you could use a brace to try and help temporarily to take some of the pressure off of your foot while you're wakening up the muscles. So you can work on the alignment of your foot, either with your footwear, your shoes, a brace, compression wear to provide a little bit of extra support. But the bottom line is going to be trying to waken up other muscles to compensate.
So Lisa's just saying, yeah, she's right now opting to just not run, and the surgeon thinks it was wear and tear over time. So if it wasn't an incident where it was like you keeled over and off after you're jumping from a 2-story building to save a cat or something in a burning building, then that's likely the issue. But I have a question on that. So is there a problem with doing, say, intrinsic foot muscle exercises that would activate the posterior tibialis as well? Because they're all related there when you're doing, say, the metatarsal pressure stuff that I teach. Is that an issue? So do you have to isolate the intrinsic foot muscles from the posterior tibialis? Or is it okay to just do kind of the intrinsic foot muscle exercises, even though that posterior tib is fully torn?
Well, she's not going to be able to activate and use the tib post tendon because it's no longer attached. So when I think when you're trying to activate the intrinsics, and normally you would require the tib post tendon there to help to maintain the alignment, you just have to make sure that when the intrinsics are activating, that alignment is maintained.
Okay.
That makes sense?
Yep. So it wouldn't change the exercises. It was just you have to really focus on proper alignment when you're doing them.
That's right.
Because it might be a little tougher to maintain.
Yep.
Okay, good. So Lisa, if you search for ankle or foot on the YouTube channel here, you'll come up with a bunch of stuff that you could start to play with and hopefully get you back. And she says she's pain-free now that I'm not running.
Bummer though.
Yeah. Okay. And I think the last kind of comment here is from Isfan. Would like to suggest a topic to address in the future. Are there supplements or anything else that is medically proven to support knee health? I will eat it all.
We'll keep that in mind, and we'll definitely have a session on what we can do nutritionally to support our body repairing and healing. Is a very, and actually I'm going to touch on that a little bit next week. So cool. Thank you.
Okay. So remind us what next week's topic is again.
So next week I want to talk about the rhythm of recovery. I think that the most successful athletes that I've seen are able to go out and work really hard, but they're able to recover quickly between their workouts so that the wear and tear injury doesn't accumulate. You know, I think of people like Roger Federer, Tom Brady, athletes, Serena Williams. These are people that are in their late 30s, early 40s, who are performing at an incredibly high level. Now, they also take their recovery to the extreme, but they understand the rhythm of how exercise is influencing their body, how potentially little micro injuries are developing, and they never let that micro injury morph into a full-blown injury. So that's what we're going to talk about next week. We're going to talk about the concept, and then what are some of the things that we can do to recover faster and better.
Awesome. Well, I will be here for that. I hope everybody else will be here as well. And that is going live next Thursday at noon Eastern time. So everybody, make sure you subscribe to the channel here, turn your little bell for notifications on. And also, if you want an email notification, go to precisionmovement.coach and sign up for the newsletter, and you'll have an option to get email notifications as well. So you do not miss this live session, because this is, I think it's just such an amazing opportunity for people to get your experience and your answers to their questions. Because I haven't met anybody with the wealth of experience and the knowledge base that you have, which is why I love doing these sessions with you, and why I love working with you so much.
Oh, thank you so much, Eric. And thank you everybody for joining us, and submit any topics that you might want to hear about in the future. Love it.
Cool. Okay. Dr. B, I'll talk to you after this.
Okay.
Everybody else, thanks for joining, and we will see you next time. Take care.
Okay. Bye-bye.